Morning, Chairman and members of the subcommittee. My name is Kristina Andrew. I'm the third chief of the Curyung Tribal Council from Dillingham, Alaska. I appear today to ask for an exemption for my tribe from the Alaska moratorium. The moratorium bars Indian Health Services from contracting directly for the delivery of services with tribes in Alaska that were not already contracting prior to 2006. The non-contracting tribes are instead served by regional intertribal healthcare entities. Our regional entity is the Bristol Bay Area Health Corporation. BBHC provides health care to 28 tribes in the Bristol Bay Area. Curyung is the largest user population in the region, over 30%. Under the current moratorium provision, only BBHC can compact for the delivery of health care in Bristol Bay region. At BBHC's inception, our tribe supported BBHC with the understanding that as the largest tribe of this intertribal organization, we would continue to have a strong voice in healthcare matters while also improving the quality of healthcare for the entire region. However, BBHC has now created an organizational structure that freezes out Curyung from any decisions related to the delivery of healthcare in our community. Specifically, BBHC has a 28-member board with only one seat designated for Curyung, but BBHC created a 9-member executive committee which does not include any representation from our tribe. This executive board makes all operational decisions for BBHC. Thus, Curyung has no voice over how the hospital or clinic intended to serve our members delivers health care. When Curyung expressed concerns in the past, BBHC took action that negatively impacted our people. At one point, BBHC issued a directive that Curyung tribal members were not to be provided care by BBHC. Thankfully, this directive was reversed, but BBHC continues to stifle criticism and concerns. BBHC continues to ignore valid concerns regarding its policies that impact patient care. For example, BBHC insists that patients can be transported out of the village only for life or limb care. This decision results in higher costs because it means people have to pay out of pocket to access higher level of care or be put on a medevac flight in an emergency. As a result of this treatment, Curyung provided notice to withdraw from BBHC in 2019. Because of the pandemic, we delayed. Once the pandemic was behind us, we delayed again to try and engage in mediation with BBHC. These efforts ultimately failed due to BBHC's refusal to meet us halfway. Our concerns remain unresolved, and we wish to exercise our self-determination rights. Our impending withdrawal means that IHS is going to have to find a way to deliver health care to Curyung. This likely means IHS will have to enter into a cumbersome FAR procurement agreement with Curyung or another provider, with none of the protections afforded to tribes under the Self-Determination Act. In the 21st century, we should have the right to contract for this health care just like any other tribe in the lower 48 and other places in Alaska. Curyung's capacity to deliver quality health care has grown. We have developed an excellent behavioral health program thanks to one-time COVID funding. By contracting for our share of IHS behavioral health funding, this small program could vastly expand to better serve all qualified Alaskan Natives living in the Dillingham area. Substance abuse has been tragic in our community, and no family has been left untouched. Without access to any IHS resources, we will not be able to sustain this program. Beyond behavioral health, we are confident that we could undertake many other outpatient services in a way that better serves our members. But our tribe needs to control our local services and resources like tribes in the lower 48. We ask that you support an additional exemption to the current moratorium so that our tribe has the maximum options available to design healthcare systems that provide the best quality care. Right now, Eastern Aleutian Tribes Incorporated, the Council for Athabascan Tribal Governments, and the native village of Eyak are exempt. Moreover, all tribes that were contracting before the moratorium was enacted are exempt. Thus, we are asking Curyung Tribal Council be carved out too so we can move forward to improve services for our community. Thank you for our plea.
Thank you, Kristina. Vivian, it's good to see you again. Morning.